Wonderful. Thanks so much, Ardo Rentila, and of course to the whole Fairmede Neighborhood Council and Hilltop Community Church. This is a great community that always has us out, has police partners, county department partners, and many more here to share with the community and to be able to talk about issues that are going on. Thanks so much, Ardo, for bringing up the issue with COVID. Unfortunately, it has taken a tremendous toll, not only in the country, but here in our own backyard in Contra Costa. Many of us, myself included, know people close to us who we've lost from COVID, and this is a concern that cannot be minimized in any way. I want to also note that along with COVID, this public health crisis, there's many issues with folks suffering depression, substance abuse, elders feeling isolated. Now is the time that we all need to come together. Reach out to a loved one, reach out to an elder, try to do something with yourself every day that can help yourself and help someone else. And never forget that we're all in this together, and it's a difficult time for every facet of our community. I want to also note that homelessness continues to be an issue throughout West County and also, of course, here in the Fairmede Hilltop area. The county does have a lease with the Courtyard Marriott. That lease will extend at least to June, probably longer, and that is there for folks in our homeless communities so that they can have shelter, the most vulnerable have shelter at this time. There are also folks in encampments throughout the area. Unfortunately, it's impossible to house all, but we're not dispersing homeless encampments now for COVID-related concerns. We do have a core team at Contra Costa County Health. You can call from anywhere, anytime, the number 211, and that can get county resources out there for crises of any kind, but also, of course, for our homeless population. At the same time, we have a vaccine rollout in Contra Costa County, and thousands of you have been signing up on the website, have been calling the phone number, and folks over 75 are at the highest priority, and that's extending to many others as vaccine supplies come into our county. Counties are the front line of the battle against COVID, and our county is all hands on deck at this time, and our communities are really responding. As the vaccine comes out, we might be able to be thinking about things like schools reopening and other aspects of our lives returning to some level of normality. What I'd like to do now is invite up our county health specialist, Dr. Sofe Mekuria. Thank you so much, Sophie. She is going to talk in much more detail about the county health department's response and what we can look forward to moving forward. Sophie, or Dr. Mekuria, please tell us more.
Thank you, Robert, and thank you everyone for having me today. I wanted to start off highlighting what Robert mentioned about during the pandemic. It's been hard on everyone with the loss of loved ones, and also hard due to the fact that we haven't been able to see our loved ones as much or maybe being more isolated. There's a lot of resources out there and resources available for individuals who are having a hard time. On our county website, coronavirus.cchealth.org, you can find a section called Coping with Stress that has some resources that individuals can call or reach out to, as well as some behavioral health resources for you and your individual. It's also important, as Robert mentioned, to check on your loved ones, to keep in contact as much as you may in different ways than we have in the past, but still thinking of everyone and keeping people connected during these hard times. I also just wanted to review some general COVID data and information about the county statistics and how we're doing in the county. As we know, on Sunday, government's released their taken away the stay-at-home order that is for all of the state, and that's in efforts that people have done for staying home in the county and decreasing the rates of COVID within our population. It's the reason the stay-at-home order was in place was actually taking a look at our hospitalization data and our capacity within our hospitals. Over the past week or so, we have seen a decrease in the cases within our county and a decrease in the hospitalizations in our county. And so our stay-at-home order has been lifted, in saying that we still have a high transmission in the county. So it remains important to continue to social distance, wear your mask and hand hygiene and other preventative measures as you continue to do essential activities. With the stay-at-home order being lifted, it does allow some businesses to be open, but indoor restaurants and eating dining is still remaining closed. It also allows for social gatherings of 25 individuals or more with 3 households, and so that is all per the state based on the case rates within our population. Additionally, I just wanted to review some information on vaccines, and as we're seeing vaccines in our county, we still are a limited amount of vaccines at this time and waiting through the allocations that the state is giving the counties. We have been working on increasing capacity to ensure that we get vaccines to everyone in the appropriate phases. As Robert mentioned, we're currently vaccinating individuals over 75 and older to really ensure that we're reaching our vulnerable population and vulnerable individuals in our county who have the highest risk of severe disease and outcomes, and also focusing on the phase 1A, healthcare workers, individuals who work or live in long-term care facilities. And we're working on increasing more capacity with partnerships with other healthcare systems and partnerships with different sites to increase access and appointments for vaccination. If you look at the short month that we've had vaccinations, we've gone from doing 0 vaccinations in our county to above 5,000 a day in our county, which is a lot, and continuing to work on capacity with the goal of 1 million vaccines given by July 4th. As long as we continue to get the allocations from the state, we will be able to reach that goal of 9,000 vaccines a day as we increase our capacity with partnerships from different pharmacies, from different health centers, and also looking to expand in other locations. That's all I wanted to review at this time, and I can open for any questions.
Thank you so much for that report, Dr. Mekuria. We do have some questions. We'll get some from the audience. Everyone watching on Facebook, please feel free to type in your questions. We'll read them as we get to them. One of the first that's coming up, Dr. Mekuria, is the issue of our homeless populations and vaccines for them. Of course, homeless health is public health. They're being enabled to either call or go online, may be compromised by their homelessness situation. What is the approach to ensuring that our homeless population, especially homeless seniors, are able to access the vaccines?
That's a great question, and we're working closely with our health and homeless individuals within our county and the resources that they have. Currently, we still are building up capacity and planning in terms of how to reach the vulnerable population you were mentioning. And currently, I forgot to mention the vaccine website for appointments, which is the same Corona website, so coronavirus.cchealth.org. And there's a section under vaccines where you can schedule a vaccine appointment if you're in the appropriate phase. And there's also a phone number for individuals who don't have access to online or having issues with the form to request vaccine. But as we have a rollout and kind of getting more allocations, would be considering ways to get into the encampments, get into the homeless population to ensure that we do vaccinate this vulnerable population as well.
Wonderful. Thank you, Dr. Mekuria. Now, another question for vaccines for vulnerable populations. We have, of course, 75-year-olds at the highest priority. Also, folks over 60 or 65 with compromised immune systems. Let's say that one of these people in one of these groups lives in West County and has private insurance through another provider, perhaps Sutter or Kaiser. What should their approach be to inquiring about getting the vaccine?
Yeah, so the private health systems, particularly the large one, are getting vaccine directly from the state, so like the Kaisers and the Sutter, and then we are working with the other health systems to allocate vaccines that we're getting from the state, so La Clinica and Lifelong. There's different approaches that the healthcare systems are doing. Some are actively reaching out to the appropriate phase and individuals who can be vaccinated or could be eligible for vaccination. Other facilities or organizations are having similar online forms. We do have some information about what different health systems are doing on our vaccine webpage. Again, coronavirus.cchealth.org/ and under the vaccine, it's a tab at the top. And so that can kind of tell you under schedule a vaccination appointment what health systems are doing. If you're not sure, if you reach out to your health system or their advice nurse like a Kaiser or Sutter, they do have plans in place.
Wonderful. Thanks so much. Another question we often get in the community. A senior over age 75 has gone on the website and signed up for the vaccine through Contra Costa Health Services. A day, or 2 days, or 3 days goes by without any feedback. What should a person in that situation do?
Yeah, we have gotten a large request for vaccines, and I don't know if you've seen the form, it's kind of a form saying how you're eligible, so your age or working in the settings under phase 1A. And then you are put in kind of a queue, and then as we get through the queue and we get capacity and vaccination appointments become available, you'll get sent a ticket to make an appointment at the vaccine site that's easy for you. Sometimes, depending on the capacity and the time frame, it can take a little while, even up to 1 to 2 weeks, depending on what location and different factors. So continue to wait. If you haven't heard or have questions, you can always reach out on the phone numbers on the website, but it can take a little time to schedule as we're increasing capacity at our vaccine sites.
So if someone signs up on the website, they can be assured they are in the queue and they will come up. If days go by, they can call to follow up if they wish, but there may be a wait time there. But again, people should have confidence that if they've registered on the website, their number will be called.
Yes, and the queues are pretty large, and so that's why it can take even 1 to 2 weeks to get kind of a ticket to schedule a vaccination. And so as we have the capacity, we do send out those tickets to schedule appointments. But we want to ensure that we have appointments available before sending you the ticket.
Fantastic. You know, it bears repeating that this is a public health crisis like most of us or all of us have never seen in our lifetimes. Rolling out vaccines, making a public health campaign of this magnitude at this speed is truly a Herculean task. And we're so grateful that county health in this county and counties across the state and country have been able to jump into the fray, and frontline workers are doing a great job the best they can. That's all that we can do, is the best that we can. Now, let's talk a little bit about getting the vaccine and after the vaccine. There's been some misinformation going around. Let's be clear, let's dispel rumors. When one gets a vaccine, talk about that timeline moving forward. I know they have to get a second dose. Also, after the vaccine, is it still important to practice precautions and so forth? Please talk about that process.
Yeah, great questions. Thank you for bringing that up, Robert. So there's currently 2 vaccines that are available and some that may become available down the pipeline. So the timeframes are a little different for the 2 vaccines. You do get your first dose and then you get a second dose either currently 21 days or 28 days after, depending on the vaccine. This is the suggested interval, and if you go past the suggested interval, it's completely fine. You still are considered vaccinated. And when you get your first dose, the county does make your second appointment for the vaccination sites and similar other healthcare organizations, although they might have different workflows. But be ensured that if you're a little off the 28 or 21 days, you are fine. Vaccines, like any other vaccine, isn't 100%, and we're still learning a lot about this current vaccine, so it's very important that we continue all preventative measures until we learn more, which includes social distancing, it includes masking, it includes testing if you're not feeling well. It also includes quarantine if you're considered a close contact to an individual even after vaccination. As we learn more, things may change, and we will update our guidance appropriately based on CDC recommendation and the state recommendation. But as of now, it is very important that you continue with preventive measures. It does remind me, I also wanted to remind everyone that we continue to have a lot of testing capacity, and it continues to be important to test if you're not feeling well, stay home if you're not feeling well, and also to test if you think you're a close contact or have any concerns, and we have testing plates all over the county.
Wonderful. Understanding that things are changing rapidly, do we have an estimate about what kind of times we are talking about for those who are 75 and over? From registration to first dose to second dose, do we have an expected timeline?
I don't know if we can say a for sure expected timeline because capacity changes and our kind of vaccine amounts change as well as we move forward. But for example, if an individual is 75 and older, we can guess or estimate that they would get a ticket between 1 to 2 weeks and then could register for appointments soon after that. If they got, depending on the different vaccines, they would get their first dose and then about a month, so 21 to 28 days later, their second dose. So the whole process of getting the full two doses could be almost like a month and a half to 2 months.
Now, as I understand it, there are 3 major vaccination sites in West County. That would be at Contra, Costa College, the Richmond Memorial Auditorium, and the West County Health Center in San Pablo. Is that the case? Are there others? And then also, it's important to note, there are not walk-up appointments at any of these locations, right? This always has to be routed through website registration or telephone call, and then you're directed to the appropriate site. Can you talk a little bit about that, please?
Yes, that is correct. We have 3 large sites here in West County, and actually currently our access for kind of appointments and sites is the most within the West County at this time frame. It is not walk-up at all. You do need an appointment. You do need to get that scheduled, and we are planning our vaccination and the vaccine doses based on those schedules, so you cannot just come into the appointment. We have also partnered with a couple of pharmacies and working to increase capacity. We're partnering with other pharmacies to give vaccinations, so there's potential a couple of pharmacies that you may be able to schedule within West County your vaccination.
Excellent. Let's talk about that age group of 65 to 74. There's been some confusion about whether they can or should get vaccinated at this time during this phase. Could you please clarify what someone between 65 and 74 should do and should expect?
Yes, so currently we are not scheduling appointments for individuals who are 65 to 74. And as we increase capacity and move through the phases, we will look into increasing that age range. We are scheduling based on age and vulnerability based on the age, and so if individuals have inputted their ticket or kind of put their registration form, we're holding their kind of registration form until we're back into that eligible time frame. And we wanted to do that to ensure that we could effectively and efficiently get the vulnerable population of 75 and older first before moving forward. All of our healthcare providers are also currently doing 75 and older, and as their capacity changes, they may kind of move into that next age group.
Excellent. There's been talk about virus mutation. This has been a global story, also a national story. What should Contra Costans know or think about virus mutation? Is there any evidence that's occurring here? And if so, what kind of risks might it pose?
Yeah, so we have no evidence that currently there. Let me actually take a step back and talk a little bit about viruses in general and COVID in general and coronaviruses. We know, generally speaking, that all viruses mutate, and it's just a natural progress, a natural kind of form of what happens with viruses. And so we expect a couple of mutations every month, maybe 1 to 2. The ones that you're probably hearing about is there's 3 main ones: the UK variant, South African, and Brazilian, and that's just where they were initially discovered. And there's no evidence that they are here. And they consider these clinically significant because potentially they could cause increase in kind of transmission in the area, but it doesn't really change at this time our thoughts on how the vaccine works. Really nothing would change in terms of what we would need to do. We would still expect everyone to continue preventative measures such as masking, social distancing, hand hygiene, vaccination when they're in the appropriate phase to really combat any coronavirus or COVID at this time.
Let's talk a little bit more about scale here in Contra Costa County. I think I heard you say, are we at 100,000 doses yet? Talk about, please, how many people have gotten the vaccine in Contra Costa County and what the rollout looks like from here.
Yeah, so we are at 100 doses of vaccine within, I think over 100,000 doses of vaccine in Contra Costa County, and people have begun getting their second doses. About 17,000 individuals got their second doses in Contra Costa County. The goal is to get 1 million doses by July 4th, and we are working to get the capacity for that, which would be about 9,000 doses a day. We are currently at 5,800 doses a day, so we're well on our way and continuing to increase capacity and the infrastructure to get more, which includes working with healthcare partners, working with pharmacies. As long as we continue to get the allocations from the state, we can meet our goal.
Now, 1 million doses by July 4th. And Contra Costa County has a population, I believe, of about 2.1 million or so. So that's nearly half of the population of the county. What does that look like in terms of public health? Like, how beneficial is that level? And what do we do moving forward? As I understand it, we're not giving vaccines to children.
Mm-hmm.
So what would be a situation where vaccinations have been given at a level that would make us appreciably safer than we are now from COVID-19?
Yeah, so in order to kind of get the herd immunity or a level that vaccine would make it safe to kind of move about normally, we would need a significant percentage of individuals to be vaccinated, so the herd immunity. And although the 1 million by July 4th isn't necessarily that percentage, it is a step in showing that we have the capacity to get all individuals who want to be vaccinated. That is correct. Children currently under the FDA approval of the vaccines can't get vaccinated, and as we get more vaccines online, we may even reach or surpass the goal of July 4th.
What level, color level, are we currently in Contra Costa County, and what does that mean?
By color level, I'm assuming you mean hospital capacity level?
I believe it's the purple tier.
Oh, I see that level. Okay. Yeah, so currently we're in purple tier. I didn't say we're in deep purple tier, and the way that the tier system is based is based on how many cases per 100,000, so kind of a rate, and that gives us an idea of how much COVID is in the community and how much we may potentially have transmission within our cause transmission. It's also based on positivity rate, which is just how many tests have been done and how many are positive. And so right now we're in the purple tier, and we're pretty high in the purple tier, and we have a while before we go into the red tier. But if we look at how the rates are declining, we could get there in a couple of weeks or so.
Despite all the good work, despite the tens of thousands of people working together in Contra Costa County, we have not been spared loss of life. Let's talk a little bit about that. What kind of a mortality rate have we seen in Contra Costa? How many folks have we lost? How does that compare to other counties throughout the state?
So we definitely have seen mortality through Contra Costa County, and it's similar to what we've seen in other counties. The exact number, I can look real fast, but and we potentially could even see, as we go through January, even more deaths, unfortunately, due to kind of the hospitalization rates, although they have been decreasing, but because we've had a high case rate over the past month or so. This is kind of similarly what we've seen all over California, all over the Bay Area, and kind of matches what we expect in a way to see for number of cases that we haven't seen within Contra Costa County. I can get you the exact number. if you have another question.
Sure, sure. As you look that up, thank you so much, Dr. Mekuria. As we're doing, let's queue up the next question that we'll be considering will be about, it'll be about practices and about, again, dispelling myths. Early in the process, that's early last year, things were fast moving, there were a lot of questions, there were a lot of competing narratives about what to do or what not to do. The viability or the efficacy of masks and hand sanitizing were called into question. Tell us that again. You're a doctor of public health, you're an expert in this field. What do we know about mask wearing, hand sanitizing, social distancing, and just how important that is to reduce the spread and save lives?
Yeah, so we do know it all works. We do know that mask wearing does significantly decrease the spread of coronavirus, similarly with social distancing and hand hygiene. Hand hygiene is particularly important in case, so washing your hands, particularly before touching your face. There's been many, many studies on masks and how effective they are to preventing disease and effective to causing decreasing transmission if you were in contact with an individual who is COVID positive. So it remains important, and it has been important in kind of controlling the spread and other preventive measures that have taken place.
Thank you so much. Now we're going to pause for a few moments here. I want you to be able to look up that data. It's really amazing. You're taking so many questions, rapid fire style, and we really appreciate it. So as we're doing that, we'll pause for just a moment. I want to reiterate that I am Robert Rogers with Contra Costa County Supervisor John Gioia's office. We are here at the beautiful Hilltop Community Church in Hilltop of Richmond, California. And we are also here as guests of the Fairmede Hilltop Neighborhood Council. This council has taken public service very seriously. It has events like this, education, and this is the most important one that I've been a part of, and I really appreciate that very much. Thank you again to Ardo Rentila and to everyone here at the church, Pastor Lauren and others, for setting up this great event so that we can be here and we can provide information that makes a real difference in terms of public health and, frankly, saving lives. On that note, did you happen to get those data figures about mortality?
I did. So in terms of Contra Costa, the total deaths that we have seen so far has unfortunately been 528 deaths in our county throughout the whole pandemic, which has been almost a year. We have seen a lot of cases, and so in terms of the number of total cases that we've seen in our county, we've seen 56,252 cases, so a small percentage of those cases resulted in death, but still a significant amount when we think of the lives lost and the impact that COVID has had in our community.
528 deaths to date in Contra Costa County.
525,
excuse me, thank you. And let's do all we can to make that number not grow. Let's take a moment of silence for those we've lost in Contra Costa County. Thank you very much. Again, that was a moment of silence for those we've lost in Contra Costa County. 525 people, unfortunately, succumbed to COVID-19. Now, let's talk about vaccine safety. This is a really important issue. There's been, again, a lot of misinformation out there. I believe I read today that there's been something like 23 million doses administered across the country. Of course, that includes the numbers here in Contra Costa County. These are all of two types of vaccines, as I understand it. 23 million doses, and I don't know that there's been any mortality from those doses. So we know we've given the vaccine a lot, and we've seen how it's working. This isn't that early in the stage so far. A lot of information can be gleaned from the process. Some people might still have questions. They might still not want the vaccine. They might still think that somehow it could hurt them. Tell us a little bit about what we know from a clinical perspective about vaccine safety.
Yeah, so the two vaccines that are available, the Moderna and Pfizer, have been proven to be safe to be given to individuals. Some individuals have had an allergic reaction, particularly if they had an allergic reaction to medications or injectable medications in the past, and if that's the case, this will be reviewed with staff members at the vaccine site. But other than these allergic reactions, it has been safe, and there's been no other side effects noted from these vaccines. Some people confuse side effects from kind of just vaccine reaction, and so some people after you get a vaccine can have a little bit of soreness in their arms, even maybe a little bit of a fever or just not feeling well for a day or two after the vaccination, particularly after the second dose of these vaccinations. That's actually a great sign that the vaccine is working. It's mounting the immunity that we want it to do, and it's not a side effect of the vaccine, but instead a natural response we expect, and that's only a small percentage. But in terms of safety and severe reactions or side effects, that we haven't really seen many, and the ones that they do, they review and monitor.
The second dose of the vaccine is very important for its efficacy. In Contra Costa County, when people get the first dose of the vaccine, and they're enrolled in the system, they're ready to go, they've been exposed to your professionals in the system, should there be any concern, is there any question that they're going to be able to get the second dose in an effective amount of time?
So as people get their first dose of vaccine within our county systems, we do schedule for a second dose of vaccine, and we are planning around that second dose, and we believe it's important that people get the first and second dose. If there's any concerns in terms of how we're getting vaccine from the state, we would prioritize the second dose to ensure once people get to get it in a timely fashion that's appropriate. So either within the interval, even a little after is fine, as I mentioned. And we do think it's important once people start their vaccination series that we have a commitment to ensure that they get their vaccination series completed through us. Excellent.
Now, as I understand it, people who sign up for the vaccine online to make their appointment, are they asked for a social security number or a credit card number? And if so, why?
So when you sign up just for the registration form, you're not really asked that information, but when you're signing up to make an appointment, you may be asked for, not a credit card, you should never be asked for a credit card, you're not charged for vaccines. Vaccines are administration of the vaccine is at no fee to you. Sometimes Social Security is asked only because you may bill your insurance if you have insurance, but if you don't have insurance, not an issue. You can still get the vaccine, but it's not required that you need to provide that if you do not want to.
The question comes sometimes, why not more? Why not bigger? Why can't we just vaccinate everybody tomorrow? What are the resource constraints that are principally limiting how quickly this can go?
A lot of the resource constraints is vaccine, just general vaccine supply, and so we get a set amount from the state and they allocate it down to us and it comes through the federal government to them. Another thing currently is just capacity. We're trying to increase our appointments and the available spots throughout the county. So as I mentioned, we're at 5,800 now, and that includes healthcare partners vaccination as well. And our goal is 9,000. So we're working, and we'll be able to get to 9,000 in terms of capacity vaccine available appointments, but it also depends on allocations to the state.
How about a 66-year-old cancer survivor with a compromised immune system? Very concerned, technically unable to get the vaccine yet. I imagine help is on the way. What can we tell them?
Yeah, so as you mentioned, they wouldn't be eligible for the vaccine at this point, and we're basing all of our choices on the CDC guidance. They continue to do all the preventive measures that they have been doing, staying away from other social distancing, masking, hand hygiene remain very important. And if they're gathering with individuals, to gather outside in areas with more ventilation, and so continue to do these measures and know that we are planning to increase capacity and work through the phases as CDC and the state recommend.
Thank you so much. I also want to mention, please, to everyone, whether you're making an appointment or you have any other concerns, visit our website at, I believe it's coronavirus.cchealth.org. This website is award-winning. A lot of people have put a lot of time into it. It's got a dashboard with the latest data and all the tools and resources that you need to keep yourself and your family safe, and also, of course, make that all-important appointment to get your COVID shot. I want to again thank you, Dr. Sofe Mekuria. You've done an amazing job. You've done the impossible, exhausted all the questions that have been coming in from online, and you've done it all with speed, accuracy, and clarity, and it's greatly appreciated. I want to again thank Hilltop Community Church, Pastor Lauren, his team, Ardo Rentila, Fairmede Hilltop Neighborhood Council, for holding this really important public event, along with many others over the years. Thanks so much to Don Gosney, I see here in the front row, always documenting information, asking intelligent questions, helping the community be informed and be empowered. Thanks most of all probably to Contra Costa County Health and your colleagues. This is a battle that's only beginning. We have a long way to go, but we're going well in many ways. With that, I invite up Ardo Rentila.
Well, I just wanted to say thank you all. Thank you everybody for coming. Thank you all for viewing. Thank you for all the questions. And come on out Saturday from 10 a.m. until the food lasts. We're going to be giving out boxes of food, and we'd like to feed you. So come on out, Hilltop Community Church, 3118 Shane Drive. Thank you very much to all my speakers. I greatly appreciate it.
Thank you.
And wear a mask and wash your hands.
Thank you.